Hi, I'm Graeme. If you have any sort of musculoskeletal pain, whether it's back pain, neck pain, shoulder pain, tennis elbow or whatever, trigger points will most likely be involved, if not the major cause. Now, the big problem is if you see someone about your pain, it most likely won't be diagnosed, or you're likely to get very expensive treatment that won't fix the problem. Now, obviously I'm going to help you with that. Now, showing you why they don't get diagnosed is easy. Now, there's bucket loads of evidence that trigger points are a big cause of those problems, but that info is kept out of medical journals. Now, for example, this study found that shoulder pain sufferers were riddled with trigger points and that treating the trigger points gave huge relief. On the other hand, these two medical journal articles that teach doctors how to diagnose and treat shoulder pain don't mention trigger points, and instead tell doctors to prescribe drugs and other therapies that don't work. Now, the drug companies don't want you to get fixed. They want you to buy their drugs for the rest of your life. Now, for the reasons why you often get expensive courses of therapy with only to have the pain return, we need to look at what trigger points are. Now, they're parts of your muscle that are spasmed or bunched up, causing a lump. Now, this tightens the muscles, restricting blood flow, and creates the ideal conditions for that lump to continue to grow. Now, looking at this chart, trigger points start small and you don't know they're there unless a therapist presses on them. Now, years or decades later, they're a lot larger and causing your muscles to tighten and fatigue easily. Now, finally, something aggravates them and they start shooting pain, and that's when you get your back pain, shoulder pain or whatever. The problem with typical courses of trigger point therapy is that they almost always do just like the large blue arrow in this diagram. They stop the trigger points hurting, but it's just reverting them back to like they were before they were aggravated. Now, there's still a large lump, the muscles are still tight and fatigue easily, and of course as soon as you aggravate them they'll start hurting again. Now, actually, it's one of my pet hates that people try to push this as scientific therapy. Now, let me share with you what they do. Now, I've got a mountain of clinical trials on trigger point therapies in my reading library, and they almost all use the same formula. Now, just say the needle people want to test dry needling, say a course of 6 sessions. Now, it's been conclusively shown that the trigger points will still be there after their treatment and the pain will eventually come back, so the researchers just measure short-term symptoms and don't check if the trigger points are still there. That way, all the 6 sessions of needling needs to do is make you feel a bit better for a short time. Now, then they can conclude that your treatment was successful and obviously help sell more needles. Don't worry though, there's an effective way you can get rid of trigger points properly, and you can do most of the work yourself. Now, I've made a separate video on that which I'll link at the end of this video. If you have any questions or comments, please don't hesitate. If you found this video useful, please leave a like or comment. Thank you very much for watching. It has been most appreciated.